This is Truth in Media. I'm Ben Swan. They may be the most vilified doctors in the country or the most heroic. Two doctors from Bakersfield, California, who stood up just a week ago and declared that the coronavirus numbers, the data they were looking at, was not what we were being told. This is
0.1% chance of death. Widespread, small amount of deaths. It's similar to flu.
Millions of people saw that news conference. But since then, YouTube has taken it down, and so-called health experts have attacked these two doctors, saying the methodology they used was completely flawed. The question is, was it?
So if they talk about data being inaccurate, let's look at the predictive models. They weren't even in the ballpark of what's possible. We're at 60,000 deaths right now. They were predicting 2 million. And if we want to talk about science, I would quote the great state epidemiologist, Dr. Giesecke out of Sweden, who said there is little or actually no evidence to sheltering in place.
New information you're not going to hear anywhere else. Today in my exclusive interview with Dr. Dan Erickson, right here, right now, on Truth in Media. Well, thanks for tuning in. By now, you've seen the video of those two doctors from Bakersfield, California, talking about the coronavirus numbers that they've seen in their community after conducting thousands of tests.
So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death.
If you haven't seen the video, well, good luck finding it, because YouTube took it down, and there's been a huge battle over whether or not this is legitimate science. Here's the problem. Immediately after this news conference, so-called journalists, and we use that term loosely, began writing articles essentially trashing these two doctors from Bakersfield, saying that their methodology was completely wrong. Let me read this to you. Public health experts were quick to debunk the doctors' findings as misguided and riddled with statistical errors, and an example of the kind of misleading information they are forced to waste precious time disputing. The doctors should have never assumed the patients they tested who came in for walk-in COVID-19 tests or who sought urgent care for symptoms they experienced in the middle of a pandemic are representative of the general population, said Dr. Carl Bergstrom, a University of Washington biologist who specializes in infectious disease modeling. And most credible studies of COVID-19 death rates are far higher than the ones the doctors presented. Here's the problem with this so-called article from a so-called journalist. What COVID studies are you citing? Where's the data? We don't see it. We see health experts and public health experts. Name them, but they're not named in these articles. In fact, the only name is Dr. Carl Bergstrom, who does in fact work for the University of Washington. And here's the other reality. Dr. Bergstrom did not bother to actually look at any of the data presented by Dr. Erickson. Not one bit of it. Never asked to see it. Did not analyze the data for himself. But the question, even without looking at the data, is Dr. Bergstrom right? Was this a improperly collected type of data? And jumping off right at that point, let's bring in our guest, Dr. Dan Erickson, talking to us over Skype. He is an emergency physician and the COO and co-owner of Accelerated Urgent Care. And Dr. Erickson, glad to have you here with us to clear up a lot of this. So the number one so-called complaint that I've seen that essentially tries to call this news conference, junk science, and these guys don't know what they're doing, is this claim that only people coming through the doors of your clinic who had symptoms were being tested. But that is flatly untrue, correct?
No, that's highly untrue. Actually, a lot of people now over the last month, if they have a grandmother at home, if they have an immunocompromised child, all kinds of people are coming in with no symptoms. And here's the bottom line of the data. The local media in Kern County said, can you give us some idea of how many you've tested and the positives? I said, sure. Here's my raw data. At the time, I had checked 5,200 people and 340 positives. I said about 6.5% of my people are positive. Now I've checked over 6,000. About 7.3% of all the people we've tested is positive. Initially, it was not randomized, and I should have made that more clear. This is a raw data dump to have a transparent process where the local media could say, oh, he's testing thousands, this many are positive, and get some idea of how prevalent this thing was. That was the whole point of the data. I'm not an epidemiologist. I was just trying to have transparent data.
Well, and transparency is a big part of this, right? Because obviously, One thing you said in the news conference, which is important that people distinguish also, because I saw the reporters who were kind of aggressive in the way they were asking you, like, so you think you know more than Dr. Fauci does? But the reality is that Fauci and a lot of the so-called health experts here are basing numbers on modeling and not on data. In fact, I haven't seen a single counter, even as of today, a single counter to your news conference that contradicts your data with data. Does that even exist out there?
Well, let's look at the original predictive models of 2 million people dying in the United States. So if they talk about data being inaccurate, let's look at the predictive models. They weren't even in the ballpark of what's possible. We're at 60,000 deaths right now. They were predicting 2 million. And if we want to talk about science, I would quote the great state epidemiologist, Dr. Giesecke out of Sweden, who said there is little or actually no evidence to sheltering in place. There is little to no evidence of social distancing. So if you're going to put an economy in complete lockdown, we need to make sure we have some good science. Because like the great Dr. Giesecke said, you can put people in lockdown and shut down an economy. We've never done this before. How are you going to bring them out? So you would think you'd have a plan with good science. If you're going to lock down an economy and take away people's income and put them into anxiety and depression, it seems to me you'd have a rational plan of going into it and a rational exit strategy, and you would show this to the public. We didn't get such a thing. All we got was predictive models that said 2 million Americans are going to die.
And they said even with social distancing in place, a minimum of 240,000 people would die. And obviously we're way off from those numbers. One more question about the actual testing. Is it true, without going into great detail, because I know there's some sensitivity here, but is it true that you guys have also tested on behalf of employers, of employees, and those were also randomized tests?
Yeah, true. So the employer would, let's say he had a shipping department, and he had one person with a fever. He would send over 300 employees, and we would test all of them. Most of them had no symptoms. I saw some of the patients. I said, why are you coming in? Oh, my boss asked me to. So we tested hundreds of people that had no symptoms at all. It was just randomly coming in for testing.
And so those who have made these claims, and again, there's been such, I would call it hack journalism. It's not even journalism. It's these hit pieces that have been written about you. And you go and you see it's the exact same story that's getting repeated everywhere. There's a very clear effort to attack the news conference you had. But has anyone associated with either news publications who have attacked you, or the University of Washington and this guy from the University of Washington who took shots at the methodology, has anyone asked to see your data? Has anyone said, let me see what you're doing so that I can critique it or criticize it?
Again, our data is raw data. It's amount of tests and positive numbers. Let me just add this. The Stanford study that was done with extreme care and scientifically appropriate analysis, we talked to the gentleman who did that. He said, I've never been so vilified in my life. This is one of the chief researchers at Stanford. And I'm going, I think they're attacking for different reasons, because his science, mine is just data. Again, let's be clear. We were not trying to do a biostatistical analysis on this. We were just giving raw data at a moment in time. The PCR nasopharyngeal swab is a moment in time that says yes or no. This is not an IgG, immunoglobulin test that shows immunity. This is a moment in time that says yes or no. We have 340 cases out of 5,200 at the time, and it's 6.5% of everybody we test. It was a basic data drop because the local stations asked us for it, and we weren't saying this is an accurate predictive model. We know exactly what's going on. That was not the point of it. And if people got that, I want to clarify. It was raw data because the media asked us to be transparent in our reporting.
But the raw data, and I appreciate what you're saying there, but the raw data that you supplied and the numbers that you were looking with and dealing with matches almost exactly what Germany found when they did their raw data study and essentially said, we have done mass testing in Germany, because Germany was very vigilant in going out and testing its population randomly. And they also came up with a number, which was 0.03% of the population. That's what they came up with in Germany as the mortality rate. And so I think it's very interesting, as I went back and listened to your conference and I went back and read the Germany report, they both came back with the same number. And then I noticed the way that media was spinning the Germany situation, saying that there is some kind of exception that's been made for Germany, and somehow Germans are less likely to die from this, which is nonsense. It's just that Germany tested, similar to what we're seeing right now in Sweden, where they did not have a lockdown, and yet their mortality numbers are pretty much in line with everyone else.
Well, I would encourage you to watch Dr. Giseki's video. Dr. Anders Tegnell and Dr. Giseki are brilliant. They are infectious disease statewide epidemiologists that have been done this for decades. If you watch their material, it's brilliant. They said, listen, the Swedish people are smart. You know, we kids under 16 are in school. Businesses are going. There's some social isolation. We're restricting groups to under 50. Other than that, there's not much other restrictions. And their death rate is 225 per million, and the United States is 175 per million. So, and again, you cannot say who really had the best strategy until this thing is over. My point is really, if we're going to shut down the economy, let's make sure we're using good science. And when I listen to these epidemiologists, they say sheltering in place and social distancing does not work, and there's not good science. And we have to ask ourselves, is the collateral damage of shutdown causing more harm than the virus itself?
I want to ask you about the herd immunity issue. You know, Sweden has come under fire for this too, but the whole concept of vaccination is based upon herd immunity. Enough people have antibodies in their system that they actually fight off the virus. In the case of Sweden, that seems to be more of the route they went to, right? Which was to say, we're going to go this route, and we're going to essentially put ourselves in a position where we can say enough people have it, and eventually the virus chokes itself out. That method has been criticized extensively here, as if a vaccine is the only answer to this. And yet you made some really important points, I thought, in your news conference when you specifically talked about some of the weight of this sheltering in place in terms of child abuse, spousal abuse, unemployment, possible suicide. I mean, there are a lot of other factors from a health perspective that are not being considered right now. Why is that?
Well, because we don't have good data on it. And people tell me, well, you're just, that's just conjecture. You're just throwing things out. I say, well, this is what I'm hearing from my colleagues. I talked to Dr. Jason Lang in Wisconsin. I talked to Dr. Witowski, who's a biostatistician, and I've asked him about numbers and what we should do and data. So I'm talking to a lot of people and trying to relay what I'm hearing. I don't have a double-blind, clinically controlled, peer-reviewed journals because it's only been 2 months. Those things take time. So I'm saying with what we've seen, with the science we know, with what we're hearing from the chief epidemiologists in different countries who are having great results, did we make a good decision? We're causing the secondary harm that you mentioned, all those things. I'm getting patients calling me, asking me for alprazolam, anti-anxiety medications. They're depressed. They're upset. This is happening on a daily basis. And I'm going, did we make the best decision? Or should we take the model of Sweden and say, let's start backing this down. Let's open up the schools first. Let's take a stepwise ladder approach, which is what Dr. Giseki mentioned. Open the schools, see how disease and death move forward. And if it's a normal uptick of the cycle, our curve is flattened at this point. And if it stays flattened and starts going down, let's open up the economy slowly and methodically. We've never done this before. Nobody has a playbook to say, here's how you open up economy that's shut down. So we're winging it a little bit. And I think the science for shutdown, I haven't seen it. If it's out there, would you please send it to me?
Well, and that becomes the whole issue as well, right? That, as you said, this has never been done before, and it's not even as if there was some kind of example in history where you could say shutdowns have worked this way, but especially for a virus that we didn't know much about. So even if you make the argument that early on, we didn't really know what we had here, and so if you give politicians the benefit of the doubt, but it seems like politicians are not listening to doctors in this process, that they're making a lot of their decisions unilaterally, and they're telling hospitals and doctors to respond to them. And you made another point in your news conference. I wanted to ask you about this, where you said we are setting ourselves up for a very dangerous situation where we have lots of other health issues happening in this country aside from coronavirus that are being ignored. Meanwhile, doctors and nurses are being furloughed right now. So how do we deal with an oncoming, almost onslaught of other medical conditions when we have damaged not just the economy as a whole, but the healthcare and medical economy?
I talked to a doctor in Wisconsin 2 days ago. I did a Zoom interview with him, and I said, Dr. Lang, what are you noticing in your hospital? He said, I'm having patients come in for chest pain 3 days late because they're afraid of COVID. I'm having people with abdominal pain come in late with much more severe problems than if they had come in day one. Why? Fear. They're thinking, I don't want the COVID. So we have hospitals with low census. We have ER doctors losing hours, nurses losing hours. And when you open up an economy, we know we're going to get more cases, and the staff just isn't there. I called my CEOs in Kern County yesterday. I said, how's your census? They said low. I said, how's your surge capacity? They said high. They said, we're sitting around waiting for patients. Our volume is incredibly low. So we've created this situation where everybody's on high alert. The tents are out. Staff is ready. And there's 14 cases in all of our hospitals in Kern County of COVID right now.
In terms of dissent, and I don't want to label you as a dissenter, but certainly as a medical professional, part of your job, part of your responsibility to your community is to report what you see going on around you, right? And to help to clarify data. You kept talking about, this kind of raw data dump, but that raw data dump, when we start to see it happen in multiple places, we get a better picture of what's actually going on in terms of a virus. The fact that YouTube took that video, that news conference that had, over 5 million views on it, I mean, tens of millions of people have viewed this news conference, but the fact that they would take that down, and I'm assuming they didn't contact you and say, can you verify what you're saying or get some clarification for it, the fact that they would take it down as if you are doing something that they would call harmful or dangerous when you're simply reporting the facts of what you see, does that give you pause in this process? I don't want you to be political about it, but does it give you pause in terms of just from a medical standpoint being told you're not allowed to have a dissenting medical point of view?
I took a Hippocratic oath when I decided to be a physician. And the one thing they asked me was, do no harm. And when I see patients in my practice being harmed by locking themselves in their house, they live alone, they're not seeing their church friends. They're not going out. They're lonely. They're depressed. Alcoholism is on the rise. And many things like this, I say to myself, I am now doing harm. My patients are calling me saying, do I have to stay in my house for weeks? I live alone. We are now doing harm. And so the key to, what I would say to YouTube is we have to be careful that we don't stifle those of us that have the patient's and the country's best interest in mind. I'm not trying to go against what anybody is doing. What I'm trying to say is let's make sure we use good science, and let's make sure we take cues from countries that are having really good results like Sweden. Let's not think that we have all the best answers. Sometimes it's best to get all of our minds together and make a good decision for the country, because this lockdown has caused so much collateral damage. I think we all can agree it affects everyone in a negative fashion.
Yeah, and the last thing I'd ask you, I appreciate, again, your time on all this, but the last thing I'd ask you is, in terms of the response from other doctors and nurses, because one of the things that I keep hearing from people is that medical professionals do not agree with these doctors. But that's not necessarily the case, correct? I mean, you have heard from medical professionals, have you not, from around the country who say, keep going with this because we're seeing the same thing?
Well, yeah, I actually have. And I've talked to Dr. Witkowski is a master's in biostatistician, and he's been doing these medical analytics for 20 years, as is Dr. Gisecki. I'm taking my knowledge from epidemiologists. Certain doctors, this is not my area of expertise, so I'm deferring to them saying, this is what they are telling me right now. I interviewed Dr. Witkowski. If you go on our Facebook, you can see it. It's 20 minutes of him saying there is no evidence for some of the things we're doing. So I'm saying if we're going to cause significant harm to our economy and to my patients, let's make sure there's good science behind it before we sort of attack me. And a lot of physicians, I mean, we're getting hundreds of them that are calling in and saying, man, we're right behind you. We're seeing the same thing in Texas and in Wisconsin and New Jersey. So I just want to make sure that we're using good science and data and not just throwing stones and attacking people's credibility.
Well, Dr. Erickson, we thank you for your time and for taking the bold stand that you have taken. Again, for sharing data and science, factual data with us, rather than just pushing out an agenda like so many other people are. We appreciate you. And thank you guys for tuning in and for watching. If you're watching this on social media, Facebook or Instagram, please like it and share it as much as possible. And if you're watching this on YouTube, well, the fact is you're probably not watching it on YouTube, because the fact is the last story I did about Dr. Erickson's news conference has been removed from YouTube, just like his news conference was, because YouTube has decided that this information is not allowed to live on their platform. How disgraceful. Again, thanks for watching. Stay vigilant and stay tuned.